Hi, Miss McClavsey. I'm a student nurse. I'm going to be doing your sterile dressing change, okay? All right, so let me get some clean gloves on here. Start taking.
Wait a second, stop right there.
That didn't look quite right, did it? Did you know that a transparent central line dressing should be changed every 5 to 7 days? And that if the dressing becomes visibly soiled, damp, or loosened, it should be changed immediately? Did you also know that a strict sterile technique is required? CLABSI stands for Central Line Associated Bloodstream Infection. The CDC recently estimated the cost of just one infection to be $16,550, which may sound exorbitant, but it isn't nearly as high a price as what some people might end up paying, because some people will end up paying with their life. The Joint Commission estimates that there are 100,000 deaths each year from hospital-acquired infections. 1/3 of those come from CLABSI. That's 30,000 plus lives we could save if we could avoid these infections altogether. Stick with us, and we will show you the right way to dress that central line. You'll need an antiseptic, chlorhexidine preferred, a sterile, transparent, semi-permeable dressing, sterile gloves, a mask, clean gloves, a bio patch, skin protectant, and don't forget your pen and label. Oftentimes these supplies will come together in an already prepared central line dressing kit. After you've got all of your supplies, head into the room. Then get yourself set up. Bring a pair of clean gloves and your central line kit to the bedside. Raise the bed to a comfortable level for you. Assemble your sterile field so you are ready to get sterile as soon as the old dressing is off. Put your clean gloves on and remove the old dressing from the central line site. Assess the site around the catheter insertion site. Remove your gloves and perform hand hygiene. Don your mask and then your sterile gloves. Clean the catheter insertion site with a chlorhexidine impregnated sponge using a back and forth motion. Allow the site to dry. Next, apply a layer of skin protectant to the skin around the catheter insertion site. Allow the skin protectant to dry. Next, place the biopatch onto the insertion site, wrapping the biopatch around the catheter itself so that it's hooked around the catheter and securely covering the insertion site. Finally, apply the transparent, semi-permeable dressing over the insertion site. Place a label with the date, time, and your initials on top of the dressing. Dispose of the rest of your supplies and lower the patient's bed back to the lowest position. Don't forget to document. Remember, we can lower the CLABSI rate. Some extra time, attention to detail, and sterile technique can lower healthcare costs and prevent hospital-acquired infections.